So many of the challenges faced by today's armed forces carry resonance to lessons learnt from the battlefields from previous centuries. Looking back, it was clear that the mental health of the whole population in the late 19th century was given a low priority. The significant advances in military capability as a result of World War I fed developments in civilian mental health care. This was a direct result of the recognition that the difference between success and defeat on the battlefield was the number of healthy combatants. These young men were facing new military technology, carrying significant payloads for harm and destruction, including high explosive artillery pieces, mines, chemical warfare, and tanks, thus exposing service personnel to types of conflict never previously experienced. Soldiers were subjected to long periods of bombardment and witnessed the horrendous mutilation and deaths of friends and colleagues. As the injured and death toll increased, then it was young men who made up the bulk of the number. The result was an urgent requirement to support and treat operationally related mental health problems, which held important implications for future trauma management and peer support interventions. From a medical and nursing perspective, it also presented a unique new mental health challenge for clinical staff dealing with men dying in agony and bewilderment. Nurses dealt with increasingly large numbers of dreadful penetrating wounds of the abdomen, chest and head, and cases requiring immediate amputation of limbs. Shell shock became a recognised condition, and it was sufficiently serious to prevent soldiers from undertaking their duties. Those who displayed exaggerated behaviour or pseudo-shell shock were quickly labelled as cowards and subjected to punishment and ridicule.
Shell shock care options included treatment at the Craig Lockhart War Hospital for Officers. This hospital was opened in Edinburgh in 1916 and offered a range of therapies such as swimming, golf, tennis, cricket, model yacht making, all forms of social prescribing activities that are becoming increasingly popular today. The neurologist Dr. William Rivers, who was appointed superintendent of Craig Lockhart, did not consider that it was helpful for soldiers to demonstrate the traditional stiff upper lip. Rivers wanted the soldiers to talk about their experiences and develop a talking cure. The strategy was to try to provide adequate support for soldiers and instill a supportive environment where patients cared for each other.
Gradually, a doctrine emerged for military mental health practice based on proximity, immediacy, and expectancy. This continues to the present day to form the basis for military psychiatry in the treatment of combat-induced mental health disorders and stress. Other lessons learned from managing the welfare of military personnel have influenced assessments and interventions in general NHS mental health services. Clinical and nursing initiatives such as assertive outreach, community-based care, crisis intervention, trauma-focused cognitive behavioural therapy, and group psychotherapy have their origins in the First and Second World Wars. Another commonality with soldiers over time has been that help seeking for mental health problems is poor, and veterans often bottle up their feelings, fearing the impact of sharing personal burdens with their family or appearing weak. It is also recognised that a mental health problem for one member of a family has a ripple effect onto other relatives.
So what mental health and physical conditions have an impact specifically on veterans and their families? Take some time and write down your answers. Then when you are ready, please progress.
We'll look at these mental and physical health conditions very shortly, but the next sentence is as important as any that you'll hear in this module. That is that the vast majority of veterans leave service without being scarred by their military career. Many have undergone personal growth and many reflect on their career as the best years of their lives. So do not presume that because a patient has been on an operational tour or served in the military, that these experiences have contributed to their presenting problems. There are many other reasons, and the way to find out is by effective communication. So let's have a brief look at some of these conditions.
Post-traumatic stress disorder, PTSD, was officially recognised by the American Psychiatric Association in the third edition of their Diagnostic and Statistical Manual of Mental Disorders in 1980. PTSD can develop after exposure to a traumatic event. These include sexual assault, traffic collisions, natural disasters, child abuse, or other threats to a person's life, and clearly has implications for those who serve or served in the military, in particular, frontline combat troops. After exposure to a traumatic event, everybody goes through a comparable psychological response, and most people who experience traumatic events do not develop PTSD. Post-traumatic mental health problems occur when the depth and periodicity of the intrusive occurrences such as uninvited images, recollections and dreams, and the level of avoidance of stimuli associated with the traumatic events, such as places and people, and the extent of the hypervigilance, such as increased arousal associated with a fight or flight response, do not reduce over time. This common response stops the individual being swamped by the occurrence and allows expectations to be amended. Diagnosis is based on the presence of these specific symptoms, and if they last for more than a month and are not improving after the event, then PTSD may be present. It's important to acknowledge that the greater the level of trauma or repeated exposure to traumatic events, then the more likely the chance of mental health problems. Therefore, it is expected that higher rates may occur in the armed forces and veterans who are perceived as being more susceptible to mental health issues. However, studies have demonstrated that levels of PTSD in serving personnel and veterans remains relatively low, especially those in non-combatant roles. In part, this is due to service personnel who voluntarily join the armed forces, who are well trained and with good morale, then appear to function extremely well, and their mental well-being can be positively enhanced by their military experiences. Support is available, and this will be covered in a later chapter.
PTSD is a serious condition that can result in a higher risk of suicide and intentional self-harm. But a more common mental health problem in the British Armed Forces and in veterans is depression, which is often closely aligned to anxiety. There are numerous factors that may influence the onset of depressive disorders, and any significant alteration in a person's lifestyle or new demands may cause stress and influence their ability to function. Stress can be caused by many factors, including poor physical health and illness, and these factors can influence the onset of mental health and depressive disorders. Depression is a diagnosis that acknowledges differences based on severity and frequency and is classified as mild, moderate, or severe. Depression is a dynamic disorder which can be used descriptively based on signs and symptoms and caused by a reaction to an event and a feeling of unhappiness as a complaint of low mood. This complexity of fitting the continuous variation in depression severity into a categorical definition poses problems to clinicians, and a diagnosis may be missed. This is further exacerbated by borderline cases, comorbid symptoms and complex presentations, often with association with drug or alcohol abuse.
Take time and think of what life events may cause stress and negatively impact on people or patients that you know. And when you're ready, please continue.
Life events including relationship problems, family difficulties, and occupational issues such as a demanding boss or working excessive hours are common stressors leading to mental health problems within the armed forces. Multiple stressors that influence the onset of depression in the Army can be absorbed into 4 major clusters, these being predisposing factors, maintaining or precipitating factors, secondary coping mechanisms, and help-seeking behaviour. These issues are clearly important for the clinical staff to be aware and to address when providing support and care. In military research, the most commonly reported symptoms of depression were low mood, followed by sleep disturbance and loss of confidence. A significant minority reporting self-harming ideology, and cited symptoms such as being angry, including fighting, being bad-tempered, feeling frustrated, memory function loss, flashbacks, physical problems, and panic. Other symptoms by this predominantly male group include exaggerated self-criticism, alcohol and drug abuse, withdrawal from relationships, over-involvement in work, and denial of pain. British military research has indicated that female soldiers were significantly more likely to attend a mental health assessment and to be admitted to hospital for a mental health disorder. They were also more prone to being diagnosed with depression and stress reactions. It would appear that women found it easier to seek support because they were more self-aware, emotionally expressive, and better at confiding in each other. Women were more prepared to seek help.
Can you think of times when veterans are most likely to need support? Please write down your answers, and when ready, continue with the module. Often how people respond to these stresses depends on their coping mechanisms. Positive means can be through exercise, but secondary coping mechanisms can include alcohol misuse, which can be a problem in the veteran population. Other issues are aligned to the veterans being on average an older generation, and therefore conditions such as dementia come into the conversation. And of course, this more elderly group are more likely to need your support, whether it be in the community, hospital, or care home setting. And as with every population, a major cause of stress is aligned to physical ill health. And in an occupation where the physical demands are so high, there is no surprise that musculoskeletal conditions can be common in the veteran population. It is worth re-emphasising that a particularly vulnerable time for veterans and their families is when they are leaving the armed forces and reintegrating into the mainstream civilian population. A UK Veterans Transition Review revealed evidence of problems for veterans who are either divorced, not in paid work, caring for someone else in their household, or living on their own and isolated. They may be faced with a combination of stressors such as accommodation, employment, and finance challenges, and this needs to be part of any assessment when talking to a member of the Armed Forces community. So to complete this chapter, we are going to say hello to the Johnson family, hear a little about their lives, and then you'll be asked to consider some questions regarding their status.
My name is Derek Johnson. I was born in Jamaica and as a small boy moved to Birmingham in England with my father, who was an electrician. He was a great man who helped build the city. And here I am, 48 years old and now living in Chester. As a boy I loved sports, but wasn't very good at the academic stuff and left school when I was 15 years old. I got work on the building sites as a labourer, which I enjoyed, as I've always preferred to be outside rather than cooped up at home or in an office. I met my beautiful wife Mary in a pub. We were both just 19 years old, and Mary was working locally as a student nurse. Once Mary qualified as a nurse, we joined the army to try and give ourselves a better life together, and we married the same year. I served in the Royal Engineers and enjoyed my time in the army. We were both 21 years old when I joined the British Army, which became my home for the next 22 years. I had the chance to live in Germany and Cyprus. I also travelled to many countries, including operational tours in Iraq and Afghanistan. The army was good to me, but I did miss my family when I was away from home. I left the army 3 years ago. As a trained electrician, I found it quite easy to find work, though I did change jobs several times in the first couple of years as a civvy. For the past 12 months, I've worked for a large electrical group. They're good employers, and now I feel settled. I live in Chester, which is a wonderful city that the whole family enjoyed when living here during my last posting. My youngest children had time to settle into school, and I didn't want to move them yet again, so I used my resettlement money to get onto the housing market. I have a small pension, which comes in handy, but I need to work to cover the bills. I like this new job as I can get extra money through overtime and working evenings, nights and weekends. I wouldn't say I have any local friends, but I'm not bothered by that. When possible, I enjoy going to Birmingham and watching the mighty Villa play along with my sons. My only vice is a small glass of whisky most nights when I'm not working, and perhaps a few beers at the weekend. I'm lucky to say that I'm in sound health, both mind and body.
Hello, my name is Mary, and I was born and raised in Brum. I met my husband Derek when I was a very young girl, but quickly knew he was the one for me. I never thought I would be joining the army, but as an army wife, it's what you do. The dreadful anxiety and fear when Derek first went on tour was terrible. I was scared and felt very, very lonely. The older army wives just seemed to know what I was going through and were like extra mums to me. We never thought for a second that we would spend over 20 years in this way of life, but we did. We gradually got used to it and began to enjoy the regular moves. From our married quarters, we had great times living abroad in Germany and Cyprus. Derek and I were always very close, and that was only deepened as the family grew with our 4 lovely children. I'm not saying it was easy, and you cannot underestimate the impact of your husband being away so much, and like most couples, we had our moments. The children changed school every 2 to 3 years, but that was all they ever knew, and the schools were right next to big barracks, so they were typical army brats. The military bases are different to anything you'll find in Civvy Street. A real bond with people really looking out for each other. As we moved, I did try wherever possible to continue nursing, and I began specialising in primary healthcare nursing. I loved nursing at the barracks, where the stories the young lads told were so funny. I miss that. But I'm now back where I started in the NHS, working full-time on a surgical ward in the local hospital. I've been there for 3 years, which is as long as I've been in any job. I've had to get used to shift patterns, including 1 week each month on night duty. I also do bank work to help pay our way. We're far from rich, but we manage. 3 years in Chester, and I wouldn't say I have any close friends, but I do go out occasionally with the girls from work. In all truthfulness, that's about as much spare time as I have, what with working and looking after the younger children. But I'm not complaining. I love my life.
Hello, my name is Ian Johnson, and I recently celebrated my 18th birthday. I'm 25 minutes younger than my sister Kate, but a lot brighter, which isn't hard compared to my sis. The army is a part of my life. I was born in Germany when my dad was serving at home camp, and I went to 4 schools by the age of 11. I loved moving around, so I wasn't over impressed when my dad said that the move to Chester was our last move. Since then, I've dreamed of the day when I'd get the chance to take the Queen's shilling. Not that I dislike Chester. I've had a great time since leaving school when I was 16. I got my first job glass collecting in the Anchor pub, and since turning 18, I've been pulling the pints. I have a great time with the locals, and if I say so myself, I'm good at my work. Dad told me that what you put in, you'll take out. And that's what I intend to do with everything I do. So I'm following in my dad's footsteps. Except I want to be a foot soldier and go where the action is. And I'm joining the infantry, and then I'm definitely joining the parachute regiment. That's my motivation. And unlike some of my mates, my fix is exercise. I train at least 2 hours every day. Not saying I don't have the odd pint, but I'm not on the lash all the time like some of my pals. Gym and football for me. And I do enjoy going to see the villa with the old man.
Hello, I'm Kate, and the more educated of the family's twins. It's not hard when compared with our Ian. He's good at sports, but not much up top. I was a proper army brat before moving to Chester 6 years ago. I'm glad I moved then, as everyone was starting in a new secondary school at the same time, and it was very different to the army schools where kids came and went every year. Here, no new children ever arrived. I've always wanted to be a nurse, and that was my main motivation in applying for sixth form. My mum loves nursing, and thought that's for me. I did alright with 7 GCSEs and 3 A levels. It was in my last year at college that we had a visit from some army nurses. It was just so interesting, and they said they would not only cover my university fees, but also give me an allowance. In a way, I've been in the army all my life, so I've decided to join. Mum and Dad have been great and really supportive, so I'm going to give it my best shot. Funny that Ian is joining up as well, and we're both waiting for our medicals. I can't wait.
And then there are my 2 youngest children. There is Danae, who is 12 in April, and our Carol, who is 10. They are great kids. They went to their first school when only 4 years old. We didn't want to put them through the turmoil of changing schools every 3 years, and we're lucky that our last posting was here in Chester. So both have local friends, and Carol has settled in well. They are good children, although I must admit that Danny has struggled academically, as he has mild learning difficulties. But the school have been great, initially giving him one-to-one support. They are very special, and will help keep me sane when the twins fly the nest.